being with us this afternoon. We've got some members of the House and Senate along with us, and we just want to make a few remarks. We're talking about expansion of Medicaid in our state. The choice we face on Medicaid is the single biggest decision this legislature has faced in years. It's a decision not about politics, but about jobs and people. It affects the lives and livelihoods of hundreds of Tennesseans and has profound implications for our state's budget. Unfortunately, our General Assembly has been in session for more than a month now, and we spend most of that time on fairly trivial matters. It's time for us to do what the people sent us here to do and tackle the elephant in the room. Our governor, as noted by President Obama just this morning, is a pragmatic businessman. He knows the consequences of not expanding Medicaid. He knows the devastating impact this will have on the public and billions of federal dollars that we'll be leaving on the table. He enjoys a very high % approval rating because the people trust him to lead. And now's the time for him to do that for him. Now is the time for him to take that approval rating and do something with it that really matters for a lot of Tennesseans. Democrats are here to get this conversation started. We filed a bill to authorize the governor to expand the Medicaid, and this morning Senator Finney and I put that bill on notice. We believe that it's a serious bill that deserves a fair hearing and an up or down vote of the entire body.
We think this bill and this entire matter addresses a number of issues, not least of which is the health care of the citizens of the state of Tennessee, as well as a moral argument to do what we can to help those people. We know that there are about 300,000 Tennesseans who don't have health insurance and could under Medicaid expansion. These are not people who live off of the government. These are our friends, these are our neighbors who work for a living, but make too little to qualify for the new health care exchanges, but too much to qualify for Medicaid as it stands now. For example, a working family of 4 in Tennessee that makes $31,000 per year would neither qualify for this Medicaid, would not qualify for Medicaid unless we take this action. Of these 300,000 uninsured Tennesseans, 80,000 are children, 80,000 children, and 35,000 are veterans. Many of them are our neighbors from the National Guard and Reserve who don't qualify for VA benefits. 1 in 4 Tennesseans lives in a rural area, and 25% of those don't have health insurance, despite the fact that we know they are much more likely to suffer from chronic diseases ranging from high blood pressure and heart disease to arthritis and diabetes. By expanding Medicaid, these rural areas and these rural families, who fully 1/3 live on less than $7 an hour, would have access to high quality preventive care.
Let's talk about the cost of this for just a moment. Medicaid expansion will not cost Tennessee taxpayers one dime for the first 3 years. After that initial period, the federal state match would begin a glide path to a permanent 90-10 match, meaning Tennessee taxpayers would actually pay about 2.5 times less for the expansion than we do for our current Medicaid enrollees. To be sure, more people would be enrolled in the program, and that would mean increased costs. But that increase is projected to be less than 1.5% over what our Medicaid growth would be without expansion. There are also numerous savings that come with expansion. HMOs have to pay a 5.5% tax on every premium they collect. Under expansion, Medicaid patients would be enrolled in an HMO, which would draw down up to $100 million in additional HMO revenue by 2016.
There's another piece of this that has only very recently been discussed. State and local governments currently pay 30% of the cost of care for patients who cannot afford to pay. Expanding Medicaid would greatly reduce the cost of uncompensated care. State and local governments that pay those costs would save an estimated $1.6 billion. That's $1.6 billion between 2014 and 2019 if we expand Medicaid.
As you know, under the Affordable Care Act, hospitals agreed to a reduction in their Medicaid reimbursement rates. They did this because they believed the poorest of the poor would not be covered by Medicaid expansion, thereby reducing the amount of uncompensated care that they provide each year. Now that the expansion has been made optional, hospitals, especially those in poor rural areas, are concerned they will be stuck with a reduced reimbursement rate, but the same amount of uncompensated care. In essence, the Affordable Care Act minus Medicaid expansion leaves hospitals worse off than before. And rural hospitals will suffer the most under this scenario. There are 61 hospitals in Tennessee's 49 rural counties. Of those, 24 are at risk of closing because they have lost money over the past 3 years. If they don't expand Medicaid, it will leave 21 counties with no hospital at all. That's why we've seen so many hospitals speaking out in favor of expansion, including, for instance, Mountain State Health Alliance and Wellmont Health System, two rival companies in the Lieutenant Governor's home district. For the hospitals that survive, there will be no doubt they have to pass even higher costs to the insurer. The cost shifting could increase a family's insurance premium by more than $1,000.
Let me make a couple of last points, then we'll be glad to take questions, or any other members can certainly address this as well. We know that there is an economic impact with expanding Medicaid. According to the Rural Health Association, 15 to 20% of jobs in rural areas are dependent upon the healthcare industry. If hospitals begin to close in rural areas, as Leader Fitchie pointed out, we'll see a devastating economic impact in our rural communities, some of whom are still suffering from double-digit unemployment. Just last week in the Senate Health Committee, the Tennessee Hospital Association told us that up to 90,000 Tennessee jobs are on the line in the healthcare industry if we do not expand Medicaid. This would be devastating for our economy. Finally, a couple of last points. There's a real possibility of doing this in Tennessee. Up to this point, I know that much of the question has been if there's political will to do this, if we have the votes to do this, and what the real interest is in doing this. I think you can look at the news across the nation over the last, even the last couple of weeks, to see that there is political will to expand Medicaid in these states and to accept these dollars for this program. We've seen Republican governors like Jan Brewer, Rick Scott, John Kasich, Susan Martinez come out and embrace Medicaid expansion. Just this morning, Governor Chris Christie announcing that he would expand Medicaid in New Jersey. You've seen traditionally Republican-aligned groups like the National Chamber of Commerce come out in support of Medicaid expansion. They do this because they understand the economic impact of failing to act. And so this is a bill that is now before us. We hope to push this in the days and weeks to come. We've talked with the administration about, obviously they know where we are, and we know what the governor has been looking at over the last several weeks. But make no mistake, the reason that these groups are coming out, the reason that these governors are now accepting these dollars is because they know the devastating impact that would take place in their state if they don't expand Medicaid. We certainly have an economic argument to do this. We certainly have a healthcare argument to do this, and I believe we have a moral obligation to do this. And that's why we'll be pursuing Medicaid expansion in the weeks to come. With that, I'm glad to turn it over to Leader Fitchie or anybody, any of our members who wish to say